Good morning, ma'am. I am Perlini Pabroques and I'm going to perform the procedures in administering an intradermal injection. Intradermal injections are injections administered into the dermis just below the epidermis. The ID injection route has the longest absorption time of all parenteral routes. These type of injections are used for sensitivity tests such as TB or tuberculin test, allergy, and local anesthesia test. The advantage of this test is that the body reaction is easy to visualize and the degree of reaction can be assessed. The first thing you need to do is to make an assessment. You need to assess for the appearance of the injection site. You need to make sure that the appearance site is free from lesions or any moles, specific drug action and the expected response, client knowledge of drug action and response, and you need to check the agency protocol about sites to use for skin tests for safety purposes. Next is to assemble equipment and supplies. So the equipment and supplies that we need are vial or ampule of the correct medication, sterile 1 ml syringe calibrated into hundreds of ml, and 25 to 27 gauge needle 1/4 to 5/8 inch long, alcohol swab, 2x2 sterile gauze square, it is optional, band-aid, optional, and epinephrine. Third is to check MAR or the medication administration record. Check the labels on the medication carefully against the MAR to make sure that the correct medication is being prepared. You need to follow 3 checks. First is when it is taken from the medication cart, before withdrawing the medication, and after withdrawing the medication. This is to ensure that the correct medication is administered to the correct patient. Next is to organize equipment, because organizing equipment will provide smooth procedure and easy access to the equipment needs. For the implementation, perform hand hygiene and observe infection control procedure. This is for infection control. Prepare the medication from the vial or ampule for drug withdrawal. Next is to prepare the client and explain to the client that the medication will produce a small wheal or bleb to facilitate acceptance and compliance to the therapy. Good morning po, ma'am. Ako po si Perlini Pabroques, isang student nurse, at gagawin po natin ngayon ay skin testing kung saan magtuturo po ako sa inyo ng gamot at magkakaroon po ito ng konting bukol pero ito po ay normal po lamang. Next is to provide privacy to gain trust and cooperation. Next is to select and clean the site. Avoid using sites that are tender, inflamed, or swollen and those that have lesions. Then, put on gloves as indicated by agency policy. Area to dry. Prepare the syringe for the injection. Remove needle cap while waiting for the antiseptic to dry and expel the air bubble to dry. Expel any air bubble from the syringe. And then, grasp the syringe in your dominant hand, holding it between thumb and 4 fingers. Hold the needle almost parallel to the skin surface with the bevel of the needle up. Inject the fluid. With the dominant hand, pull the skin at the side and tilt out. Insert the tip of needle enough to place the bevel through the epidermis into the dermis. The outline of the bevel should be visible under the skin surface. Next is to stabilize the syringe and needle and inject the medication carefully and slowly so that it produces a small wheal to the skin. And then, withdraw the needle quickly at the same angle at which it was inserted. Do not massage the area, dispose the used material properly, and remove your glove. And then, circle the injection site with ink to observe for redness or induration per agency policy. And then, document all relevant information: the testing material and dosage given, time and route, site, and the nursing assessment. That's all. Thank you.